My name is Kamal Syed, and I did my medical school in Karachi, Pakistan. And then after doing 1 year of internship in Pakistan, I applied for residency programs over here in US, and I actually got accepted in Houston at Baylor College of Medicine. So I did 3 years of internal medicine over there, followed by 2 years of gastroenterology at Baylor College. And then the GI program over there is kind of a little bit of a pyramid. A couple of us get selected for the advanced endoscopic training. And so I did a third year at Baylor College. And advanced endoscopic training is basically to do with the pancreas and the biliary tree. So that's where I got some extra training on that. So in the field of gastroenterology, my interest initially was pancreatic and biliary pathology. But as my practice has evolved, I've really become, I think, much better at colon cancer screening. And obviously, with colon cancer being a common problem, I sort of evolved into making that my specialty. Though I still do all other endoscopic procedures, ERCPs and upper endoscopy and the test, but that's been, I've evolved into being more of a colon specialist. It's always rewarding when the patients have immediate relief of the discomfort. Whenever I've gone in and removed patients' blocked esophagus with a piece of food bolus, for the patient that is very rewarding. I mean, they feel relieved, their pressure goes away, their pain disappears, they can swallow. And obviously prior to that, they couldn't do any of that if the person is in somewhat of moderate level of agony. And we do that quite a bit, at least a couple of times a month. So I think that definitely is something that I would say is rewarding for the patient, because you get immediate results and they feel 100% better. So what I'm looking forward to most in the GI field in terms of the advances is the way we are progressing towards doing more and more less aggressive and minimally invasive procedures that are being developed, and it's benefiting the patients. So we're talking about endoscopic surgery. I think that's going to be a huge thing in the next 5 to 10 years, where we don't do any incisions on the abdomen at all and do surgery from inside, removing gallbladders, removing appendices, making connections between the intestines for different indications. So I think that it still is in its infancy, I think, but once that gets fully established, I think that's going to be a huge thing. And clearly not for the surgeons, because that in a way kind of encroaches onto their field, but I think for the patient it's going to be tremendously good for the patients.